Today you're watching us treat this patient's submental area and also, as you can see, her necklace lines. The treatment plan that we've selected for this particular patient is PDO smooth threads. PDO, also known as polydioxanone, is a dissolvable suture. So the suture is loaded onto that needle, as you can see, and we're laying the needle under the skin. After the procedure is complete, we will remove the needles but leave that suture behind. After about 4 weeks' time, the suture starts to dissolve and stimulates neocollagenesis, which literally means new collagen growth. Collagen is what gives our skin that tight, supple, and firm, youthful appearance. As we age, though, our collagen stores are dropping off, and so that is why over time our skin is more thin, there's less support, and it starts to sag. This patient we have already treated with lifting threads, and she has got a nice lift from the lifting threads, but she continues to have this persistent laxity under her chin, and that is her primary complaint. So that is why we decided to do polydioxanone, because we're hoping to regain that tight skin under the jaw with the new collagen that's going to take place here. So the patient was numbed for about 15 minutes with a BLT-like topical anesthesia, and as you can see, she's tolerating the procedure really nicely. Once those threads are placed in the proper plane, they just glide into place. The patients generally don't feel much of anything once they're numb, and they tolerate it really nicely, and the procedure tends to go quite fast. So you can see here we're just about done in that submental area. This treatment should be repeated every 4 weeks for 3 months. The peak collagen production that we tend to see from polydioxanone is about 3 to 6 month time. So we'll treat her monthly for 3 months and then give her a break while that collagen is really riding high and, being stimulated at the peak that it's going to be. And so then we'll give her a little bit of a break and then bring her back and see if we need to repeat the series or if we're happy with the results that we were able to accomplish. You can see here we're getting ready to remove those threads. It does require twisting them in order to leave that thread behind. So you can see we're twisting those threads and then we're just going to remove the needles. And the procedure will be done in the submental area. Then we'll move on to the necklace lines. Again, the necklace lines is going to be the same procedure. She was numbed with BLT, and we're going to be placing those threads directly into the necklace line to hopefully stimulate collagen to fill in those deep creases. Tech neck is another name that we refer to for patients with the creases in the neck. Just going to clean her off here, and then we'll move down to the necklace lines. As you can see, we have markings on the neck. You're certainly not married to these lines. They can certainly change. So you'll see, I think my first thread is a little bit off from where my marking is. The most important thing that you need to keep in mind is we're laying these threads almost like a scaffolding, or imagine perhaps mesh. So you want to get as much coverage underneath the skin, because that is where the collagen is going to take place. Where we place the threads is where we're going to have the collagen production. So you can see when we treated her submental area, we laid quite a bit of threads in a small treatment area, and that is because we're really trying to maximize the collagen. So if you envision where the threads are placed, that's where we're going to see that collagen production. So you want to cover as much treatment area as you possibly can. So again, here we are placing the threads in the necklace lines. You can see we're pulling that skin nice and tight. This allows for a smooth treatment surface. Especially in the neck where there's contour, they can be a little bit trickier to place, but if you really try and flatten that surface out, it's easier to stay on the proper plane. These can be a little bit uncomfortable to leave in the neck, so I usually will, if the patient tolerates it, you can go ahead and leave them and then remove them once the procedure is complete. If they find them uncomfortable, then you can twist and remove as you place them, but she's doing quite nicely with this. She's a wonderful patient of ours. And you can see now we're just sort of working our way across midline. That one she mentioned was uncomfortable, so I took it out as soon as it was placed. So polydioxanone, PDO smooth threads, they're very easy to place once you're properly trained. It's very important that patients are seeking trained, certified healthcare professionals to place these threads. Yes, they appear easy, but that is because this is being done by a certified and experienced injector. So patients should always be sure that when they're looking for an injector, they're looking for someone who has the experience, they have a thorough understanding of anatomy, and they have a lot of experience placing these threads for the best possible outcome and the safest outcome. We teach PDO smooth threads in our PDO smooth threads AAFE training courses. We hope to see you at a course soon so that we can teach you all of the different indications for PDO threads. These are incredibly versatile. As you can see here in this one patient, we've treated her submental area, we've treated her necklace lines. They're also wonderful for treating acne scarring or even scarring for any other reasons. Maybe they had a surgery or an accident and they have a scar that you're trying to break up that scar tissue and fill in the area with new collagen. They're also wonderful for areas of volume loss, an eyebrow lift, and deep static wrinkles. Especially in the glabellar area where filler is not safe, PDO smooth threads are an excellent use there in the glabellar area to help fill in the deep creases that we see in those sort of pesky 11s, especially for your older patients who have never had Botox. So if you're interested in adding PDO threads to your practices, we hope to see you at a training course sometime soon. Thanks for watching.